put your hands together for him. Your hands together is the one that is doing my homework. You are sketching me. Not now, you're sketching me.
Yeah, thank you everybody for this opportunity to learn, because I believe in learning mutually. I met my own self, Lucky, the drugs. And today we'll be talking about a very interesting topic, because what is a country without workforce? What is a bank without workforce? What is a hotel without workforce? It's very important we understand the basic, we understand the pertinent aspects of this important topic from basic principles. So, wellness at the workplace. Looking at this picture, you can see that this executive CEO and manager that has a lot of people's documents to sign here is already having a problem. And you can see that obviously there will be a ripple effect on the productivity wherever she's working. So I remember my humble self once again, Lucky, doctordrugz, and we also have the opportunity to talk about certain things like having access to health information. That is very, very important. Because the problem known is what? Half solved. Hence, doctordrugz is also a company that gives access to free health information, and it's all over popular social media platforms where you can watch all forms of videos that will teach you about basic treatments and management of conditions from basic principles, as we're going to see here. So, wellness in the workplace. I'm just trying to reason with everybody here. If everyone could do everything, no one will need anybody, right? But this is the case. Hence the need for workforce. Because we will need ourselves. Because everybody needs someone. So we have to work together. That's what this is trying to tell us. So the productivity of a workplace is directly proportional to the number of qualified people, because you cannot carry a carpenter into the theater. Am I correct?
Absolutely.
And you cannot carry an aileron into the back, right? Then we'll also, and it's also going to be dependent on the effective work hours. When we were in secondary school way back, we used to call people stabo. That stabo means people that jump classes. When the teacher comes in, they follow from the back, and you can see that such a person will not learn anything. Also in the workplace, if somebody is absent, that means the number of work hours that the person should have put in has what? Gone down. Then also, anything that affects health affects the aforementioned factors, which are the number of people and the number of work hours. And ultimately affects what? Productivity. And that is why this, what we're talking about here today, is very, very important. That's why we're here. So today we're just going to go straight into one or two or three ailments or conditions that affect work productivity via affecting health. And that's why I'm going to talk about peptic ulcer disease, then sciatica, which coincidentally the previous presenter mentioned this, if you can remember, and thigh or hemorrhoids. But because of time, I want to do something unique today. I want us to choose one of these topics to start with, so that in case we get tired, we can call it. So are we going to go for peptic ulcer disease, sciatica, thigh or hemorrhoids? Those in favor of peptic ulcer disease say aye. Indicate that's one. Those in meanwhile, sciatica is that thing that can make someone's leg become paralyzed. The pain radiating from the waist down the sciatic nerve to the leg, causing tingling and all that, making it almost impossible for you to either sit down, stand up, walk around, or anything. So, are we, those in favor of sciatica, say aye. Those that are not, say nay. Okay, good, the ayes have it. And how many of you, can you just indicate? We have 1, 2, 3, 4, 5, 6, 7, 8, okay, 9. Now, those in favor of fire, say aye. Okay, so from democracy, we start from what? Sciatica. So put your hands together for that very wonderful. Yes. So this is what, just look through the screen and see what we have talked about with regards to vertical disease. But I'm going to flip through so we can just go down to sciatica. Just look, because maybe some other time we're going to start from this. Okay? This is the chief actor that damages the inner lining of the lining of the the stomach and other parts of the gut that causes ulcer. This is how it happens. These are the things that lead to it. You can see aspirin, ibuprofen, and other non-steroidal anti-inflammatory drugs or analgesics that people take for arthritis and other things, actively drilling holes where inside the stomach. You can see the complication. This is what it looks like. A lot of people don't know what it looks like. So that's why they say, I'm managing my ulcer. As if the ulcer is a friend or a neighbor or a colleague at work. But they don't know this is what it can cause when it perforates. It can cause obstruction, leading to bloating, loss of appetite, vomiting. That's how we diagnose. This is what Zerudiah will say a mucometer. That is what we use to look inside, but it's actually called an endoscope. Then, this is how it is in Nigeria. These are the challenges from Sabinus to drug resistance, all that. Then you can see prevention and treatment. This is how chemical intervention tries to help, but unfortunately these days, Helicobacter pylori is more rugged than the ones that affected our parents. And you can see this is a standard treatment. This is one of the only few times I put this on the internet because I know that it is completely treatable and I have had 100% cure rate with this. And then this is how natural pharmaceuticals help. Then we'll see a few of natural pharmaceuticals and how they work, what they contain, their MOA, etc., etc., etc. Then, at the end of the day, we're down to sciatica. They're not the fastest lecture on earth. So that's one idea. So sciatica, but in brackets, lumbar dislocation. The aim is to make us understand what this is. The beauty of this topic you chose is that you actually chose a 3-in-1. That means you're going to gain 3, just like going to buy a phone and they give you 2 extra. That's what we're going to do because it has a lot to do with what? Arthritis. But this time around, we'll be talking about arthritis of the knee, we'll be talking about arthritis of the spine. Okay? The lower spine. Talk about arthritis of the lower spine. Then we'll talk about the management and treatment. You know, we can't talk about sciatica. Sorry, I'm lefty. You know, we can't talk about sciatica without talking about the human bones and joints. And then there's something called spondylosis. A lot of us have heard about it. A lot of us have heard about this, and we wonder why you see it on people's X-ray results. You see spondylosis. We see, is there another mic? Hello? Then we'll see what causes it. then the sciatic nerve itself, we'll talk about that. Then we'll talk about the signs and symptoms, causes and risk factors, complications, and we'll talk about management. And then we'll talk about something that a lot of us do not understand. Why is it that when you take drugs for sciatica, it doesn't go? You'll see why shortly. Because it's like a mystery, but it's not. It's simple. I will explain why, and then we'll talk about the best ways to handle it and prevent what is called a 50-50 surgery or a decompression surgery, which is one of the most unsuccessful surgeries of earth, because the name itself says 50-50. That's the nickname, meaning that the probability of you having that surgery without being paralyzed is 50%. And that means having that surgery means you have a 50% chance of being paralyzed. So you must sign that form that in case you are, you will not take anybody or hold anybody to ransom. So we have about 270 bones when we are born, then we have 206 as we grow. Our bones weigh 14% of our entire body weight. So let's not say we have big bones in my family. That is a scam. Your bones weigh about 14% of your weight. So highest your bones can be maybe 15%. That doesn't really affect the whole 100% of your weight, because people find it difficult to lose weight and give all forms of excuses. And then we have calcium, chondroitin, sulfate, and all that. Take note of these molecules here. So these words, joints. These words, you can see we have different kinds of joints, but today we're going to focus on this type, because this is the one that lines up with our spine and helps us to pad it. Okay? And that's where problem starts, because in sciatica, because immediately this blue part here that balances the banker when he's sitting down on the chair in the office from morning to evening. When he sits down on the chair from morning to evening, you find out that when this begins to have issue, thank you very much. So you can see problem starts when this beautiful padding here begins to get eroded off, and the sciatic nerve roots that comes out from these sides begins to get compressed. Hence the name of that surgery, which is decompression surgery. You understand? So you can see that when it happens here, you see that in some, especially women around menopause, they begin to have issues in their knee because of the drop in what? Estrogen, which is osteo or bone protective. That's why it's very important we take note of this as women, because it's actually going to help us to understand the importance of taking substances during or before, during, and after menopause. We have a topic on that separately for some other time where we talked about menopause. I've done research on that and it's awesome. So, this is what the padding in our backs look like. Maintaining this padding is very key in preventing that low back pain and or the sciatica that results as a result of this padding being eroded. And as you can see here, so this cartilage often lack blood and nerve supply. That's why they heal very slowly. But some people like a quick fix, so they keep taking aspirin and other things that can lead to what? Peptic ulcer disease. So these paddings act as what? Shock absorbers. And they are very important in our skeletal structure, especially in regards to structural support and help to reduce friction. But bear this in mind, we have two major aspects in this pattern. We have the outer ring, which is made up of something that we will be surprised to know, and that is collagen. You know, women apply collagen in their good, have collagen in the creams and all that. That helps to make the skin firm. Collagen is also very important in the joints, and you see that this fibrous area that is called the annulus fibrosus supports a softer inner layer that contains, who can guess what this inner layer contains mostly? Water. Water, up to about 70 to 80% of the inner area that is soft is composed of water. So if you're in the office and you are not drinking enough water, don't be surprised that you are being predisposed to having that low back pain that can begin to shoot down the legs. All right. It's just a depiction of what I'm talking about. You see, this is the thigh bone, the lower end of the thigh bone, and the upper end of what we call the tibia fibula. That's this down below the knee. Yes, the bone below the knee. You can see the beautiful padding that's supposed to be there, and that when this beautiful padding gets eroded, the origin of all these problems begin. This is what they look like under the microscope. Wonderful. This is the back of someone that has been working for long without taking good care of themselves. This is the back of people that take a lot of sugar, have a lot of joint stress, are overweight, or have very severe forms of menopause. That is severe complications of menopause that has destroyed the intervertebral paddings or discs in the spinal column. And then this is what the healthy spine should look like. Please take very close cognizance of this picture, because there's something that I'm going to show us very soon and will help us understand why it's important to take good care of ourselves. So let's start from spondylosis, because that is the origin of most cases of sciatica. So it's simply what osteoarthritis of the spine, and its types are based on the affected region of the spine, e.g., when it happens in the neck, it's called cervical spondylosis. When it happens in the lower back here, somewhere around here, it's called lumbar spondylosis. But we're going to focus more on this lumbar area because that is where the sciatic nerve root emerges from. It's also known as degenerative disc disease. Okay? And now spondylosis or osteoarthritis of the spine can cause what they call lumbar disc herniation. So when this, look at the hard disc protecting the inner softer layer of the padding. You see, when there's damage to this ring here as a result of excess sugar consumption, as a result of factors that affect this area, like probably excessive load or obesity or weight on the back, you can see the sciatic nerve is being squished. And look at this red part, it's showing that there's inflammation taking place there. And that inflammation is what causes that pain in the back, especially people that are having desk jobs. For instance, for example, bankers and other. Also, people that stand a lot as well, like the traffic officers and all that. So spondylosis is the degeneration of the spine that can cause the disc to lose what? Hydration. You see that water is also very important. If you want to try this, try walking for days and starve yourself of water, and you will see that you will start to have backache. Because this soft area that accumulates a lot of water is designed to cushion or pad the effect of our weight on our spine. So you see, water is indeed a wonderful drug or medicine. So now, this leads to tears and weak spots around the outer hard ring full of collagen, hence it bulges out and squeezes on the sciatic nerve and causes nerve roots and causes problems. But sometimes that ring may not get broken. And in that case, we have what is called a lumbar disc bulge. So it just bulges and leans on the sciatic nerve, but it has not ruptured. The outer ring was not broken. So this is highly reversible if handled early, because the factors that lead to this are not as aggressive. No, the same factors lead to both of them, but they have not caused enough damage to rupture. Read. We're still talking about a similar incident as we spoke of when we talked about the lumbar spondylosis. This is still the same pattern, but this is just a clearer version. You can see how this one broke through the hard ring in the back of the spine and is squeezing on this yellow thing here called the sciatic nerve. Now, you see this thing in here is coming straight from the brain, this middle section. Unfortunately, some people even have this one, rather than go to the left, it comes this way. And then you can see that the person becomes what? Paralyzed. Completely. That means the person will not be able to even walk at all. So you can imagine a banker walking like this to go and attend to customer and raise the leg up. You see that the workforce that is provided by such a person has already turned to something close to what? Zero. I have a patient that was fired. She's in charge of the canteen or something like that. And then, because she could not raise her leg as a result of sciatica, she was too slow. And you know they work with time. So when the banker has break, food that would have been set to the person in a split second, the woman is going like this, and has to serve a lot of people. They had to go. And that was how she lost her job. Because of this thing we're talking about here. That's why it's very important to pay close attention. Now, this is what the sciatic nerve looks like. The one that supplies the leg and the one that gets affected. This is what it looks like. You can see it coming out of the lower back where I pointed here. You can see them coming out of this is the sciatic nerve roots, and they merge somewhere behind or within the buttocks and goes down. That's why people that have issues, you hear them saying that they have a shocking pain that starts from where? The back here and shoots down the leg. And that is the nerve that conducts that pain down the leg from where? From the back. You see how clear it is? So, as we are speaking, you see that the way we can actually handle this matter is becoming clearer and clearer to us, right? Remember that this part here is bearing what? Our load. From our head, our shoulder. I remember when she was saying her head, my shoulder. From our head, our shoulder, our tummy. That means if a woman is pregnant, she can exert excessive weight on this aspect, on this part here too. That's why you see sometimes pregnant women find it difficult for them to what? Lift their leg. And they're having what? Backache. Have you not seen how pregnant women walk sometimes like this? Because why? Sometimes the sciatic nerve is being compressed as a result of the weight of the triplet in her stomach, and of course she has added weight. Hence, you see that it also, can be it's related to the topic we're talking about today. So the sciatic nerve is the longest nerve in the body, running from the lower back down to the leg, originates from here with lumbar and sacral spine and travels down the back of the thighs, the knee. If I show you my phone, you will see maybe more than 300 or 500 people that have sent me messages recently. When he said that it's one of the most common conditions today, it is increasing exponentially. Before, our ancestors used to go to the farm, they eat natural things and all that. Their sciatic nerve used to be what? Maintained. But now we have all forms of fast food, sugar, and all those things causing inflammation in this area and eating off the collagen fiber that is supposed to pad the bones in the back. You see that this issue is becoming more and more rampant. Am I making any sense to us?
Yes, sir.
And that's why you see that oftentimes people that have white collar jobs, especially those that are very active in the bank and sit down from morning till night or stand from morning till night, often have. Just check around you see that some people have this problem, but they keep it to themselves, and when they get home, they do something that will show us not to do ever. You see it because they feel that that's the solution, but you see why it is not the solution. Remember how these things are coming out from in between these bones. That means there's a bone on top, there's a bone below, and the sciatic nerve is coming out from where? The center. I will tell us what I call the scissors effect. That is why when I say do not massage, you see some people go to where they massage their leg, their back. They can carry a tractor and be climbing their back up and down. They say, this man can massage. They now pay the man 20,000, 30,000. Till the next time, that person is destroying that person's back. Because it will have a scissors effect. The bone on top can try to meet the bone below and cut the sciatic nerve root completely, and that leg will become what? Paralyzed. You'll find out shortly. So you can see that it's getting more and more interesting, right? Now, you see that it controls the knee, the leg, and even down to the skin on the leg also have their link to the sciatic nerve. And that's why you see they start having. Some people have even symptoms like some men have symptoms like hot flushes that happens in women that have menopause because of this problem. They see this fire, it's burning my head. That's what we call neuropathy, nerve damage. Now, the sciatic nerve controls muscles and muscle function and sensation in the leg, including the hamstring, quadriceps, and calf muscles. It also provides sensation to the skin, as I mentioned, toes, and all that. Now, compression. Remember I mentioned decompression surgery, right? So, compression or irritation of the sciatic nerve root can cause pain, numbness, tingling, and weakness in legs, also known as what? Sciatica. Ladies and gentlemen in the Lord, we have finally arrived, and this is sciatica. So we started from lumbar spondylosis. We talked about how the padding in between the bones compress the sciatic nerve roots. Then we talked about other factors that have landed in what the major topic for today, which is sciatica. This is a very clear picture of what happens. Can you see the soft gel-like inner layer I'm talking about? You see it's blue, showing what? Water. You understand? Then you can see this dry-looking thing that is like fibrous something. This is full of collagen. You understand? So that collagen that women apply in their cream that makes their skin smooth is also very important for what? Joint integrity. Anything that damages these collagen fibers predisposes people to what? Arthritis. But today we're talking about osteoarthritis of the spine, which is also called spondylosis, that leads to our topic of today, which is what? Sciatica. So the sciatic nerve is the longest nerve, as I mentioned, and that is how it gets damaged. Look here, you can see how it came. This was coming from the brain. You understand? This is just like that, this Lekki Express road that we have roundabout. Then it's going left to Marwa, going left and right to Ikate and everywhere. So you see what has happened to Ikate Junction. That means the whole of this side will be having traffic. And that traffic is what? Leg pain, known as what? Sciatica. Does that make sense to us? This is a clearer picture. I had to put this picture so that people will have a clearer understanding of what we're talking about. Look at the one coming from the brain all the way down and branching left and right just as the road branch out from Lekki roundabout. I mean, you can see the ones that are now branching to the leg here. Can you see how this one is shining red as a result of pain? Because the bones are squishing on their source or their beginning, which is called the sciatic nerve root. Look at where you normally sit down on in the office. Can you see the bum? What we call the gluteus maximus. Look at it here. You can see that inside that gluteus maximus, can't you see the nerve running down? And that's why it's difficult for some people to walk. When they sit down, they stand up in the office and they're doing like this. They can't walk well. Sometimes you see someone who just stand up from the chair thinking that he's going to be able to stand up and run normally. And he say, wait for me, I'm coming. Hey, my back up. That is it over here. But let's not forget that it can also happen here in the neck. But that's not what we're talking about today. In the neck is called cervical radiculopathy. You see some people, you see their hand, they cannot move their fingers well. There was a woman that called me on the phone and was crying bitterly. I said, what happened? She said she cannot spread cloth on the line. No. She finished washing clothes. She was trying to raise her hand, and then it was as if her hand could not go beyond the level. Just as it can affect the leg area and it's called sciatica, we can also have what is called cervical radiculopathy, because the cervical vertebrae are found there in the neck. You see that? So people that are carrying heavy load on their head morning till night are prone to something like this. But it is worse, because remember that even the leg and all that have their own supply passing through here. That is why someone that has a very terrible cervical spondylosis can be completely, in fact, they even urinate on their body. They cannot hold, they have what they call fecal incontinence, urinary incontinence. In fact, the powerhouse of the downstream sector for the entanglement facility is completely off duty. A lot of issues and all that, because so this is even worse. But God has helped us, because the neck does not carry too much load normally. Apart from what? So we talked about sciatica. You can see how it happens too, based on what we mentioned. Now let's just go to signs and symptoms. Pain, number one. Radiating pain. The type that is like if Shango is firing somebody in the back. That type that will shoot down the leg. Then we talk about numbness and tingling, weakness, muscle spasms. Who has seen somebody that's, if a footballer that's had muscle pull before? You see how the leg will be doing like something like a fish that they brought out of water. Then you see limited mobility, painful movement, sitting or standing intolerance. You can imagine somebody that is, just imagine a pastor that's supposed to come and walk to the pulpit and talk. And I've been sitting down carefully and happily clapping for them. When they now say, we're introducing Pastor Lagwaja, and he stands up and he starts walking like this. Oh my God, what's going on? It's a problem that can be as a result of what? Sciatica. We have food drop, loss of reflexes, painful coughing and sneezing, and all that. But remember that not everybody displays all these symptoms, because no two people are the same in life. The causes and risk factors. Of course, looking at this guy here, we already know where the dog is what? Biting. After this bite now, how do you think this guy is going to go and play football? His sciatic nerve has entered inside the mouth of somebody else's dog. Now you can see lumbar disc herniation, as I aforementioned, degenerative disc disease or lumbar spondylosis, herniated discs, where we talked about the outer ring being ruptured and the softer area squishing on the sciatic nerve root. Then we talk about spinal stenosis. That's it. We'll talk about that some other time. It just means that the spinal cord is being compressed in that area. Piriformis syndrome is what I talked about, the one that affects just behind where my finger is pointing, the gluteus, within the gluteus maximus area. Then we talk about spinal injuries or trauma. We have spondylolisthesis. That means a bone in the spinal column can slide and squeeze on the sciatic nerve root. You understand? And that is where we have such data. Of course, aging. Now, I want to give us the baptismal name of what causes sciatica. It is called age-related degenerative disc disease. That is the full name. Age-related degenerative disease. But we shorten it to what? DDD. Degenerative disc disease. But the baptismal name is age-related degenerative disease. So as people get older, they have a higher tendency. And it's worse in women that are around menopause because of the drop in what? Estrogen. Then genetics, of course, so people have a naturally They are genetically predisposed to these issues. But genetic tendency is not genetic sentence. That means somebody can have a genetic propensity or tendency to have a problem, but with proper lifestyle changes and proper lifestyle, it may never happen. We'll talk about lifestyle diseases some other time, and we'll see how even hypertension, type 2 diabetes, fatty liver disease, high blood cholesterol, how other lifestyle diseases like heart attack, stroke can be treated and or reversed. We'll talk about that maybe some other time. Obesity is the problem because we're saying that somebody that is even not too fat, the back is complaining that it's too heavy, and then you go and add extra weight on your spine. That worsens. Then we talk about menopause. Can you see her here with her broom flying like a witch? Look at hormonal changes during menopause can lead to what? Sciatica in women. Menopause is not a disease. It's a natural occurrence in women. But it has comorbidities or complications that accompany it. It is always better to tackle these comorbidities early so that the weathering processes of menopause will not allow things to fall apart. Then we have diabetes. Remember we talked about sugar and collagen. Sugar is inflammatory in nature and directly breaks down collagen fibers because it makes them brittle. If you know friends that have diabetes, you see that they are older. That they look older than people that don't, that they are mates that don't, because the collagen in the skin has been what? Is being destroyed by the sugar. It makes collagen fibers more brittle. That's why people that have, in fact, the collagen fibers in the anus, when they are affected by too much sugar, the blood vessels in the anal area can lose their integrity and lead to what? Pile. And some people will say, jedi. Oh man, sugar. Man, sugar. Takes too much of sugar. Don't take too much of sugar. This is what some of our mothers used to say. Then, joined with high job stress. You see some men carrying heavy furniture on their heads and crossing road like this on the express road. They used to dodge bus, dodge car. And then when they go back to sleep at home in the night, they cannot perform their regular wonders they normally perform in the other room. Because they have already compressed the what? The sciatic nerve. And they cannot sleep. They cannot stand. They cannot walk. Because they are having jobs with what? High joint stress. It's also a problem. So apart from you loading your backbone with weight as a result of obesity, you can go and carry on that person. You go and have a girlfriend that is as big as an elephant, and she coming in the airport and she's running towards you at 100 kilometers per hour to come and jump on you to carry her, and you two carry yourself and put there. My brother in the Lord, your back will tell you later. So these are the complications. Looking at this guy here, you can know everything is already. This man cannot sit down, he cannot stand up, he cannot lie down, he cannot walk, he cannot, in fact, even to write is not a problem. He's closing both eyes in pain. How can he see what he's writing? Because you can see that sciatica is showing this man in Hausa what we call shaking. Now, sciatic nerve root damage, chronic pain, foot drop, amongst others. But look at where somebody's powerhouse has been connected to NEPA, no light. You can see what will happen here: impotence, paresthesia, and all that. Anxiety, lack of sleep. Who can sleep with pain? Then you can see muscle weakness. Now, peptic ulcer disease is just part of the Ashebi of the problem. You know that Ashebi follows the right. So the Ashebi of the problem is what? Peptic ulcer. Because of the pain reliever, the person will be swallowing like chin-chin. Remember that painkillers are what? Killers. I'm a health practitioner, hospital-trained pharmacist. That means I'm a doctor, I'm a pharmacist, I'm everything. And I'm telling you that all these painkillers we are writing for you are what? Killers. Starting from who? Paracetamol. Paracetamol is an assassin of liver cells. As you're drinking paracetamol and chewing it as like chin-chin, your liver, in fact, in the lab, you want to shut down the liver of an animal to do experiment. Just give the animal, the rat, paracetamol, the liver will just pack his load and go off. That's what people are swallowing. So be careful. Then depression and suicidal tendencies. Imagine a soldier that cannot even stand up because of work, and you're a major general. Your juniors will begin to overtake you. You see that in front of your house, and you're seeing your people that you were giving training when they came. They are collecting stars. You are sitting down, and you'll be depressed because you cannot stand up. A soldier was brought to my house with Sienna. The family members carried to my house. I was just coming and say, we are going to your place. What happened? Then this soldier stationed in Jos, you chatted Sienna because they watched a video that I did on Sciatica. And they started searching for me, and they came to my house and said I must do something. I had to do something, but I won't tell us because I don't want to misguide everybody. Of course, I had a decompression exercise I did for him. And of course, someone that could not walk into my house walked out of my house, and the wife was just saying, but not for everybody. Now, he was just lucky. After the decompression, we had to decompress, not surgically. There was a way I did it, and the guy could walk home. So you can see that guy was so depressed. In fact, after I performed what I did, which I don't want to say, the guy refused to stand up. He has never felt relief like that in a long time. He said they should leave him to even enjoy the little freedom he has had, because his both legs were what? Paralyzed. Hefty, handsome guy. He slowed down. Sciatica has finished it. So that's why it's important that we avoid it. Because loss of focus. Who can focus with pain? Economic issues. By the time you start, nobody will tell you to buy. When they say buy pregabalin, you'll be buying it. If they say one card is 100,000, you'll be buying because of the work. One thing that Nigerian women always say is what? So what's I go job now? But of course, we know that we have a lot of things to eat. But because sugar is addictive, and when you take carbohydrates, it forms sugar or glucose in the blood that leads to release of what Prof mentioned at that time, happy hormones, which is number one, dopamine. And that's why people are addicted to carbohydrates, oftentimes. It is as addictive or more addictive than cocaine. You understand? So when you are taking these carbohydrates, your brain is enjoying it because it is tickling your brain's fats. And you keep taking it, not knowing that it's also destroying collagen fibers where. And also leading toward obesity. Because all those energy you are consuming, where will your body store it? Your body will store it as fat. People do not even know that fat is a store of what? Energy. The way your cars, you store petrol in the tank of your car. That is the way you store fat in your body to use to what? Produce energy. Dieting, sugar is inflammatory. Just talked about it. Physiotherapy, because for muscle tone. But I'll tell us something very important. For those people that say they are going to, there's one man, he knows how to set goal. You will see what somebody said recently. Quit smoking. You know that smoking damages DNA because it leads to increase in what we call free reactive oxidative species or free radicals that damage DNA directly. And your DNA is your MD CEO, managing director, head of board, members of everything that has to do with you. In fact, you are DNA of your